The hushed reverence of Apex Medical Center's observation gallery shattered under Dr. Vikram Kulkarni's pronouncement. "Your career in football, Javi, is over." The words, delivered with a chilling finality, struck Javi Santana like a physical blow, his athletic frame visibly deflating on the pristine gurney. Dr. Kulkarni, renowned neurosurgeon and master of the dramatic exit, didn't wait for the echoes to fade before declaring his resignation from Apex, a theatrical flourish on a stage of despair. He saw an irreversible brachial plexus injury. He saw a dead end. Lost amidst the hushed despair and frantic administrative whispers, rookie nurse Aisha Rahman stood by the sterile cart, barely visible. Her modest uniform was a stark contrast to the gleaming hierarchy around her. She watched Javi, not the star athlete, but the man, sensing the heavy curtain of hopelessness descending. Kulkarni had missed something. Her eyes, sharper than her station suggested, caught a subtle, almost imperceptible twitch in Javi's flexor pollicis brevis, a detail dismissed by the expert. Where others saw finality, Aisha saw a question. A quiet, dangerous conviction ignited within her: they were wrong. The hushed reverence that usually clung to Apex Medical Center, a shrine to medical excellence and cutting-edge science, had curdled into a palpable dread. Dr. Kulkarni's pronouncement, a guillotine severing Javi Santana's illustrious career, echoed through the gleaming corridors, amplified by his dramatic, self-serving exit. The air, usually crisp with antiseptic, now felt heavy, thick with the unsaid weight of finality. Javi Santana, once a titan on the pitch, was a shadow in room 412. His powerful physique seemed to shrink against the starched white sheets. His famous hands, which once orchestrated balletic passes and thunderous shots, lay limp and unresponsive. The brachial plexus injury, a tangled devastation of nerves in his shoulder, had stolen not just his livelihood, but his very identity. Dr. Kulkarni's final word, irreversible, was a cold, clinical eulogy. The previous, unsuccessful attempt at repair, a complicated surgical foray that had only confirmed Kulkarni's initial assessment, now stood as a stark monument to futility. Standard diagnostic scans, high-resolution MRIs, intricate CT myelograms, detailed nerve conduction studies, NCS, and electromyography, EMG, had all painted the same grim picture: extensive damage, unresponsive tissue, no hope. Aisha Rahman moved quietly through Javi's private suite, her humble presence a stark contrast to the opulence and despair that filled the room. Her duties were routine, monitoring vitals, administering prescribed analgesics, changing dressings. Yet, her focus was anything but routine. Each interaction with Javi, each fleeting observation of his injured arm, was a meticulous data point in her mind. The faint, involuntary tremor she'd first noticed in his flexor pollicis brevis, the muscle controlling the short thumb flexor, persisted. It was a minuscule detail, easily overlooked, especially when the greater picture was so catastrophically bleak. Kulkarni, in his brilliance, had seen a dead end. Aisha saw an anomaly. Her eyes scanned Javi's arm again, tracing the path of the median nerve, the ulnar nerve, feeling for subtle changes in muscle tone, observing the slight, almost imperceptible discoloration that hinted at chronic, low-grade inflammation, rather than acute, catastrophic nerve death. She knew, from her unconventional training in environments where resources were scarce and diagnostic tools often non-existent, that the body held secrets beyond the resolution of even the most advanced MRI. Extremes had taught her to trust touch, sight, and an intuitive understanding of complex anatomical interplays. The hospital's hierarchy was personified by Dr. Eliza Kovac, head of orthopedics, who now strode into Javi's room, a whirlwind of authority and sharp, tailored professionalism. Her white coat was immaculate, her gaze piercing, her reputation as unyielding as the titanium she often implanted. Kovac had inherited the Santana case by default after Kulkarni's dramatic exit, and the burden of a high-profile, failed patient clearly chafed. She embodied Apex's unwavering belief in its own infallibility, and Kulkarni's final diagnosis, however inconvenient, was now Apex's immutable truth. Nurse Rahman, Kovac's voice was crisp, lacking warmth. Status report. Aisha straightened, a flicker of nervous energy warring with her deep-seated conviction. Vital signs stable, doctor. Pain managed with multimodal analgesia. Minimal edema remaining post-op. However, she hesitated. I've observed continued, very subtle fasciculations in the thenar eminence, specifically suggesting an irritable median nerve branch, despite the reported complete nerve discontinuity from the scans. Kovac paused, her pen hovering over Javi's chart. Her eyes, cool and analytical, fixed on Aisha. Fasciculations? Nurse, the EMG showed a complete lack of motor unit potentials distal to the lesion site. Are you suggesting Mr. Santana is suffering from phantom limb twitches? There was a thinly veiled sarcasm in her tone, an immediate dismissal of Aisha's observation as naive, perhaps even impertinent. Aisha felt a flush creep up her neck, but she stood her ground. No, doctor. These are focal, involuntary contractions, distinct from phantom sensations. They appear to be true neuromyotonia, indicating a persistent, irritated motor unit. Given the previous surgical findings and the extensive imaging, I just wonder if it could be a highly localized, secondary entrapment, perhaps a tiny fibrous band or scar tissue, constricting a fascicle that may have been overlooked. Kovac's thin eyebrows rose. A slow, chilling smile touched her lips. Nurse Rahman, are you familiar with Dr. Kulkarni's reputation? His mastery of peripheral nerve surgery? Or the caliber of our diagnostic imaging? You're suggesting that the renowned Dr. Kulkarni, aided by million-dollar equipment, missed a tiny fibrous band? She let the words hang, laden with condescension. The scans, and Dr. Kulkarni's direct surgical exploration, conclusively ruled out any treatable compression. What you are observing, nurse, is likely artifact, or perhaps wishful thinking. The median nerve is severely damaged, if not completely deafferented. There is nothing to entrap. The words were a hammer blow, designed to put Aisha in her place, to reinforce the impenetrable wall between the experts and the support staff. Her theory, so bold and dangerous, wilted under Kovac's withering stare. Aisha could feel the heat of Javi's gaze, though he remained silent, the hope that had briefly flickered in his eyes now extinguished, replaced by a dull resignation. Later that afternoon, during routine rounds with a team of residents and medical students trailing in her wake, Kovac returned. Aisha, assisting another patient down the hall, watched as Kovac demonstrated Javi's extensive sensory deficit to her entourage. As you can see, anesthesia of the median nerve distribution here, Kovac stated, dragging a blunt neurotip across Javi's numb palm. Total loss of sensation. Irreversible. Aisha's mind raced. Kovac had focused on the obvious, the anesthesia, a hallmark of severe nerve damage. But Aisha remembered something else, Javi's subtle complaint, delivered quietly to her during a pain assessment, about a strange, deep ache that he couldn't quite localize, a sensation he described as feeling like my hand is asleep and screaming at the same time. It wasn't the absence of sensation that was most telling to Aisha, but the aberrant sensation, the paradoxical pain. It spoke not of a dead nerve, but of a nerve struggling, irritated, and perhaps, still viable, if only a single fascicle. She took a deep breath, her heart thumping against her ribs. She had to try again. As Kovac turned to leave, Aisha stepped forward. Doctor, excuse me. Mr. Santana also described a deep dysesthetic pain, particularly in the thenar area. Could that not suggest a persistent C8 or T1 root irritation, potentially involving the medial cord or even a distal fascicle, rather than complete, irreversible deafferentation? The room fell silent. The residents exchanged uncomfortable glances. Kovac slowly turned, her expression turning from irritation to outright fury. Nurse Rahman, she said, her voice dangerously low, your duties involve patient care, not armchair neurosurgery. Are you truly suggesting that you, a rookie nurse, have uncovered something that Dr. Kulkarni, myself, and a battery of specialists have missed? That these subtle twitches and dysesthetic pains point to some magical, overlooked nerve in a patient whose brachial plexus has been definitively mapped and explored? Her voice rose, carrying through the quiet ward. Let me be very clear, Mr. Santana's case is closed. The diagnosis is irreversible. Any further speculation from non-specialist personnel is not only unprofessional but dangerous. It gives false hope and undermines the entire medical team. Am I understood? Aisha felt the weight of every disapproving eye, the silent reprimand from the residents, the raw disbelief from Kovac. Her face burned. Understood, doctor, she mumbled, her voice barely a whisper. The humiliation was absolute, crushing. She had pushed too far, overstepped her bounds, and been summarily put back in her place. Javi, who had been listening intently, watched Aisha's retreat, a flicker of something new in his despairing eyes. He had seen the conviction behind her quiet words, the unwavering belief in her unique perspective, even as the walls of medical hierarchy closed in around her. Kovac's harsh words, meant to quash Aisha's burgeoning ideas, had inadvertently done the opposite for Javi. They had given Aisha's wild theory a dangerous allure, a compelling counter-narrative to his grim prognosis. For the first time since Kulkarni's verdict, a tiny, reckless spark of hope, a desperate questioning of the absolute, ignited within him. He watched Aisha disappear down the hall, her shoulders slumped, but her eyes, he noted, still held that dangerous, knowing gleam. She might be humbled, but she was not broken. Not yet. The sting of Dr. Kovac's dismissal, the palpable humiliation of being put in her place, still burned. Aisha retreated, her shoulders heavy, but her mind, stubborn and unyielding, refused to let go of the puzzle that was Javi Santana's arm. Kulkarni's pronouncement of irreversible nerve damage echoed like a death knell in the sterile halls of Apex, yet something in Javi's presentation gnawed at her. She returned to her rounds, but her observations of Javi were now hyper-focused. The standard post-op care felt hollow, a mere formality for a limb condemned. Kulkarni had confidently cited extensive avulsion of the C5, C6, C7 nerve roots, a catastrophic injury. Yet, as Aisha helped Javi with his passive range of motion, she noted the subtle but persistent burning paresthesia radiating down his forearm, a symptom far more indicative of active irritation and entrapment than the complete numbness of a fully denervated limb. Moreover, the dermatome mapping for C7 seemed off. The sensory loss wasn't absolute, but patchy, almost like a distal lesion superimposed on a proximal one, a hallmark, in her unconventional experience, of compression, not just avulsion. The tremor, too, wasn't the fasciculation of dying muscle, but an erratic, almost rhythmic twitch deep in the hypothenar eminence, a tiny rebellion from nerve tissue fighting for survival. Standard MRI scans, while excellent for gross anatomical damage, notoriously struggled with subtle fibrous bands or microentrapments deep within the brachial plexus. EMG and nerve conduction studies, done preoperatively, had shown widespread denervation, supporting Kulkarni's diagnosis. But Aisha knew these tests often failed to differentiate between severe compromise and complete transection, especially when a significant portion of the plexus was indeed avulsed. They could paint a picture of devastation, masking a salvageable pocket of compressed vitality. Her experience in field hospitals, where sophisticated imaging was non-existent and diagnostic acumen relied solely on meticulous clinical observation and a deep understanding of peripheral nerve dynamics, had taught her to look beyond the obvious, to trust the body's whispers over the loudest declarations. Over the next 2 days, as Javi's initial shock morphed into a grim acceptance, his pain, instead of settling into the expected chronic ache of a denervated limb, began to escalate alarmingly. He was still on a potent cocktail of opiates and neuropathic pain medications, but the sharp, shooting agony would rip through him, specifically in the distribution of the median nerve, triggering a guttural cry that echoed through his private suite. This wasn't the dull throb of muscle atrophy or the phantom ache of loss, this was the visceral scream of an actively tormented nerve. Aisha documented every nuance, the escalating numeric pain scores, the new, hyperlocalized tenderness along the medial aspect of his arm, the telltale changes in skin texture, a subtle coolness and pallor in the distal forearm and hand, indicative of an autonomic response to ongoing neural distress. This was not the trajectory of an irreversibly damaged nerve settling into its quiet demise. This was a nerve being actively crushed, starved, and provoked. The situation was becoming emergent. Every hour this went unaddressed, viable fascicles were dying. During morning rounds, she found Kulkarni and Kovac outside Javi's room, reviewing his chart with an air of professional regret. Kovac, ever the pragmatist, was discussing palliative options. Kulkarni, meanwhile, looked detached, as if the case were already closed in his mind. Aisha took a deep, fortifying breath. Dr. Kulkarni, Dr. Kovac, she began, her voice steadier this time, bolstered by Javi's worsening agony. I've been monitoring Javi's pain. The intensity and character of his dysesthesias, particularly the sharp, burning, radicular pain in the median nerve distribution, coupled with the new autonomic changes, suggest a progressively worsening focal irritation. It's inconsistent with a purely avulsive injury where nerve ends are no longer transmitting. It points towards an ongoing, active compression. Could it be possible there's a secondary fascicular entrapment, perhaps a dense fibrous band or scar tissue, constricting the viable nerve bundles deeper within the plexus that the initial scans, and even the exploration, might have missed? Kulkarni, his gaze piercing, slowly lowered Javi's chart. Nurse Rahman, he stated, his voice a low, dangerous rumble, we have been over this. I performed the initial decompression. I personally examined the entire plexus. There was extensive root avulsion. Extensive. The MRI was unequivocal, the EMG corroborated. There is no hidden fascicular entrapment playing hide-and-seek in a limb that is, for all intents and purposes, neurologically defunct. Your observations are, frankly, speculative and border on medical insubordination. His tone left no room for doubt. This was a direct challenge to his surgical acumen and diagnostic authority. Dr. Kovac stepped forward, her expression a mix of weary patience and professional disapproval. Aisha, I understand your concern, but you are a rookie nurse. Dr. Kulkarni is a world-renowned neurosurgeon. His assessment, backed by state-of-the-art diagnostics and his unparalleled experience, is the definitive word. We're managing pain and discussing realistic, palliative outcomes. Your suggestions are not only unsubstantiated, but they risk giving false hope to a patient who desperately needs to accept his reality. We don't chase shadows because a patient's pain escalates, especially when it's expected for a catastrophic injury. Please, adhere to your duties and respect the established diagnosis. Aisha felt a fresh wave of despair wash over her. They weren't just dismissing her, they were dismissing the undeniable signals of Javi's body. But doctor, the progression, the type of pain, it's not typical for a stable denervation. It indicates a dynamic process, an escalating ischemia from compression. Time is critical if there are still viable fascicles. Kovac sighed, her patience clearly wearing thin. Nurse Rahman, the brachial plexus is a tangled web. Postoperative pain can be unpredictable. We've already increased his dilaudid. Your theories are, respectfully, outside your scope and without any supporting evidence. We are not going to re-explore a brachial plexus based on a nurse's hunch about dynamic processes in an irreversible case. Do I make myself clear? Aisha's shoulders slumped. Yes, doctor, she mumbled, her voice barely a whisper. The humiliation was absolute, crushing. She had pushed too far, overstepped her bounds, and been summarily put back in her place. Javi, who had been listening intently, watched Aisha's retreat, a flicker of something new in his despairing eyes. He had seen the conviction behind her quiet words, the unwavering belief in her unique perspective, even as the walls of medical hierarchy closed in around her. Kovac's harsh words, meant to quash Aisha's burgeoning ideas, had inadvertently done the opposite for Javi. They had given Aisha's wild theory a dangerous allure, a compelling counter-narrative to his grim prognosis. For the first time since Kulkarni's verdict, a tiny, reckless spark of hope, a desperate questioning of the absolute, ignited within him. He watched Aisha disappear down the hall, her shoulders slumped, but her eyes, he noted, still held that dangerous, knowing gleam. She might be humbled, but she was not broken. Not yet. The pain, a cruel master, was also a relentless advocate for any sliver of a different truth. And Aisha, it seemed, was that truth's last, quiet champion. Driven by that fragile spark, Javi intercepted Aisha in the quiet corridor. Nurse Rahman, he urged, his voice raspy with desperation. "Tell me about this secondary entrapment. What did you see?" Aisha, her surprise quickly replaced by quiet determination, explained her unconventional diagnostic maneuver. It wasn't about fancy scans, but a specific, almost imperceptible physical exam, a subtle palpation and movement sequence that could pinpoint minute, overlooked nerve compressions. She articulated how his unique twitch wasn't nerve regeneration, but a telltale sign of a rare, secondary issue. Just like Aisha, sometimes the most profound insights come from the most unexpected places, challenging the established order. If you're rooting for the underdog to defy the odds, and believe in the power of hidden expertise, make sure to hit that subscribe button. Javi, captivated by her conviction, felt a desperate, reckless hope begin to flare. Could this humble nurse truly hold the key? The air in the sterile hallway of Apex Medical Center, usually hushed with the quiet hum of professionalism, now seemed to crackle with an unspoken tension, an echo of the drama that had unfolded. Aisha, shoulders heavy with the weight of her dismissal, walked with a deliberate slowness, her mind still replaying Kovac's sharp rebuke. She felt the eyes of nurses and residents on her, pitying, curious, perhaps even a little gleeful at the rookie's comeuppance. But then, a voice, low and urgent, broke through the din. "Nurse Rahman." "Aisha." Javi Santana, his face drawn but his eyes ablaze with a fierce, almost desperate hope, had caught up to her. He blocked her path, his broad shoulders filling the narrow corridor, a silent challenge to the unwritten rules of hierarchy she had just been so firmly reminded of. "You can't just walk away," he pleaded, his voice raspy. "Not when you've given me something." Aisha hesitated. Her professional instincts screamed at her to maintain distance, to respect the pronouncements of her superiors. But his gaze, so vulnerable yet so commanding, held her. "Mr. Santana, I'm just a nurse. Dr. Kulkarni and Dr. Kovac are the neurosurgeons. And Kulkarni quit. And Kovac dismissed you, but she didn't disprove you. She just decided. I've been decided on enough. I need to understand what you saw. What you felt." He reached out, a gentle hand on her arm, his touch surprisingly steady. "Please. Explain it to me. Really explain it." His desperation was a palpable force, pulling her in. Aisha led him to an empty consultation room, a small, impersonal space filled with a faint antiseptic scent. She closed the door, a symbolic severance from the judgmental gaze of the hospital. "It's about how nerves heal," Aisha began, her voice gaining a quiet confidence as she stepped onto familiar ground. "Or, rather, how they sometimes don't. Dr. Kulkarni's surgery successfully repaired the primary trauma to your brachial plexus, the torn nerves, the avulsed roots. But in environments of extreme injury, where healing is rapid and often aggressive, scar tissue can be incredibly insidious." She grabbed a pen and a pad of paper, sketching rapidly. "Imagine the brachial plexus as a complex electrical cable, where individual wires, fascicles, carry signals. Your primary injury was like cutting a main cable. Kulkarni reconnected it. But during healing, sometimes, a thin, almost microscopic fibrous band can form. Not necessarily on the outside of the main nerve sheath, which is what standard scans like MRI often look for. But inside. It's a secondary entrapment, a tiny lasso around a single fascicle, or a small group of them, constricting them as they try to regenerate. It's too small for conventional imaging to pick up, and too subtle to register as a full nerve compression." Javi leaned forward, captivated. "But how would you find it? If scans can't see it?" "It leaves a unique signature," Aisha explained, sketching a crude diagram of the nerves branching into the arm. "The symptoms don't fully align with the expected recovery pattern of the original injury. There are specific, seemingly minor, sensory or motor deficits in distinct dermatomes or myotomes that indicate a localized compression, distal to the main repair. It's like a tiny short circuit within the main cable. When I saw your pronator drift, and the subtle weakness in your flexor carpi ulnaris, combined with the disproportionate paresthesia in your little finger and ulnar side of your hand, it didn't fit the established prognosis. It pointed to something impacting the ulnar nerve, specifically some of its fascicles, high in the arm, perhaps where it passes through the arcade of Struthers, but after the main plexus repair. She continued, her eyes alight with the diagnostic challenge. My experience in extreme trauma environments, where resources were scarce, forced me to rely on hands-on, meticulous neurological examination. I learned to listen to the nerves, to interpret these subtle discrepancies. With a specific maneuver, a combination of careful palpation, nerve gliding exercises, and sustained positional stress, I believe I could pinpoint the exact location. It's like tracing a fine thread within a complex tapestry, looking for the tiny knot. Javi stared at her, a profound realization dawning. So it's not a major surgery. It's a precision strike. Exactly, Aisha affirmed. A minimally invasive microdissection. The goal would be to carefully explore that specific segment of the nerve, identify the fibrous band, and release it. The risks are inherent in any neurosurgery, potential for further damage, infection, bleeding, but if done with extreme precision, they could be significantly mitigated. The benefits, if my hypothesis is correct, could be profound. Javi rose, his despair replaced by a potent resolve. This isn't just hope. This is a plan. And I'm not letting them ignore it. He didn't waste a minute. His powerful agent, Marcus Thorne, arrived within the hour, a whirlwind of furious phone calls and legal threats. Javi's story, coupled with Aisha's detailed, albeit unconventional, explanation, became a weapon. The hospital, already reeling from the PR fallout of Kulkarni's sudden departure and the potential lawsuit from Javi's career-ending diagnosis, couldn't afford another misstep. Marcus, a master of leveraging influence, made it clear either they explore every avenue, or Javi would take his story, and his very public recovery, or lack thereof, elsewhere, potentially igniting a media firestorm that could tarnish Apex's elite reputation irreparably. The chief of staff, Dr. Evelyn Reed, a woman whose calm exterior barely concealed a steel spine, summoned Dr. Kovac to her office. Dr. Reed laid out the situation with chilling clarity. Javi Santana was a brand, a public figure whose plight was rapidly becoming a headline. Denying a desperate patient an exploratory procedure, especially one described as minimally invasive and supported by some medical logic, however unorthodox, was a public relations nightmare they couldn't endure. Kovac bristled, her voice tight with indignation. This is an insult to medical science, Evelyn. A nurse, contradicting a renowned neurosurgeon? It sets a dangerous precedent, undermines surgical authority. Vikram walked out. Eliza, Dr. Reed countered, her gaze unwavering. His authority is currently in question. And Nurse Rahman isn't contradicting him, she's identifying a secondary pathology that could have developed post-op. It's not an admission of error, it's a reevaluation based on new observations. A microdissection, under your expertise, presents a controlled environment. If she's wrong, we confirm Kulkarni's diagnosis. If she's right, Javi Santana's career is saved, and Apex Medical Center is hailed as the place where the impossible happened. The pragmatic appeal finally landed. Kovac paced, her mind racing through the potential outcomes. The humiliation of being guided by a rookie nurse was immense. But the alternative, a public relations disaster, potential legal battles, and the specter of being seen as obstructionist, was worse. She also knew that if there was something there, and she was the one to find it, she would ultimately get the credit. Fine, Kovac snapped, her jaw clenched. An exploratory microdissection. I will be the lead surgeon. I will be in command. Nurse Rahman will assist, but she will follow my direct orders, and any decision in the OR will be mine. I will not have a junior nurse dictating a procedure. Dr. Reed nodded, a flicker of relief in her eyes. Understood. Her role is to guide, to identify. Yours is to operate. It's a collaboration. Kovac scoffed. A collaboration of necessity. We will schedule it immediately. Aisha learned of the decision from Dr. Reed herself, an hour later. The news hit her like a physical blow, a potent cocktail of vindication, terror, and an immense, crushing responsibility. Her quiet, internal conviction was now public, under the unforgiving glare of an operating room, under the skeptical scrutiny of Dr. Kovac. She was no longer just sensing an error, she was being given the chance, against all odds, to prove it. The weight of Javi's hope, the challenge to Apex's rigid hierarchy, and the profound surgical risks now rested squarely on her humble shoulders. The turning point was here, and there was no turning back. The sterile air of Operating Room 5 hung heavy with the scent of antiseptic and nervous anticipation. Javier Santana lay prone, his left arm carefully positioned and prepped, revealing the faint scars from previous, unsuccessful surgeries that had tried, and failed, to reclaim his career. Dr. Kovac, a formidable figure even beneath her surgical mask and loops, dominated the room. Her presence was a cold, sharp blade, expertly honed. She stood at the head of the surgical field, her gloved hands already reaching for the first instruments. Aisha, her heart thrumming a frantic rhythm against her ribs, took her assigned place near the operating microscope, ready to assist, ready to guide. "Scalpel, please," Kovac commanded, her voice crisp and devoid of warmth. Dr. Lee, the attending resident, quickly passed the instrument. The incision was swift, precise, following the line of the previous scar. Muscle layers were carefully dissected, retracted, revealing the intricate landscape beneath. Kovac worked with impressive speed and confidence, her movements economical and practiced. She exposed the general area of the brachial plexus, but her brow furrowed slightly as she surveyed the field. There was diffuse scarring, expected from prior interventions, but no obvious, easily identifiable entrapment. As expected, she murmured, more to herself than the team. "Generalized fibrosis." Nothing screaming. Aisha leaned closer to the microscope's oculars, adjusting the magnification to a higher setting. She knew Kovac was looking for macroscopic impingement, a thick, constricting band or an obvious neuroma. But Aisha wasn't looking for the obvious. Her gaze meticulously traced the delicate, glistening chords of the brachial plexus, seeking the subtle nuances that only her unique expertise could discern. She saw the familiar, shimmering white of the nerve tissue, but also something else, a minute alteration in the way the fascicles nested together, a barely perceptible ripple that spoke of abnormal tension. "Dr. Kovac," Aisha began, her voice quiet but steady, cutting through the low hum of the OR equipment. "Could we increase the magnification on the superior fasciculus of the lateral cord? Around the junction with the musculocutaneous nerve origin?" She pointed with a sterile indicator to a spot on the live monitor feed from the microscope, barely visible to the unassisted eye. Kovac paused, a slight irritation flickering in her eyes above her mask. "Nurse Rahman, I am perfectly capable of identifying nerve structures. I've been doing this for 20 years. She adjusted her own microscope, zooming in on the area Aisha indicated, expecting to find nothing. Her movements were stiff, her skepticism palpable. Still just fibrosis. General scarring. "Yes, doctor," Aisha acknowledged, her composure unwavering. "But observe the perineurial sheath there. It appears under tension, almost flattened, compared to the adjacent fascicles. And if you could apply just the slightest, most gentle traction on the musculocutaneous branch, notice the lack of characteristic nerve glide." Kovac scoffed, but a flicker of professional curiosity, however grudging, compelled her. "Dr. Lee, assist with microretractors on the musculocutaneous nerve." Gentle traction, minimal. Lee complied, delicately applying tension. Under the increased magnification, the subtle effect Aisha described became marginally more evident. The fine, silvery threads of the perineurium, the connective tissue sheath enclosing nerve fascicles, and that specific region did indeed appear unusually taut, almost stretched thin. The expected, smooth roll or glide of the nerve fascicle within its surrounding sheath, a sign of unimpeded movement, was absent. Instead, it seemed subtly tethered. "Still just fibrotic adherence, Nurse Rahman. Common after previous surgeries," Kovac stated, her voice tight with dismissal. She still wasn't seeing what Aisha was. "With respect, doctor," Aisha pressed on, her humility battling with her fierce conviction. Consider Javi's specific pattern of sensory deficits, the patchy numbness in the lateral forearm, the weakness in the biceps despite motor nerve integrity. It's not indicative of a bulk entrapment. It points to a specific fascicular compromise, precisely within the C5/C6 contribution to the musculocutaneous nerve, which originates from this lateral cord. Her gaze swept the monitor, then back to Kovac. That specific tension on the perineurium, doctor, isn't just adhesion. It's a restrictive fibrous band, nearly transparent, compressing the fascicular bundle from within the epineurium, making it almost invisible to standard observation. Kovac's jaw tightened. From within the epineurium? That is exceedingly rare, nurse. I've seen perhaps a handful in my career, and they are usually clearly identifiable on high-res MRI. And yet, Aisha countered softly, Javi's scans were clear. The pathology I observed in the war zone, due to repetitive microtrauma and inflammation, often created these insidious, almost invisible internal entrapments. They don't appear as mass lesions. She paused, then continued with a clinical precision that belied her junior status. If you would use the blunt microdissector, Dr. Kovac, and attempt to gently separate the epineurium from that specific fascicular bundle, you will feel the resistance. It's not the usual give of scar tissue. A profound silence descended upon the OR. Dr. Lee, usually focused on assisting, was now openly staring at Aisha, a mixture of awe and disbelief on his face. The other nurses and anesthetists exchanged surreptitious glances. Aisha, a rookie, was not just questioning the eminent Dr. Kovac, she was instructing her. Kovac glared at Aisha for a long moment, a battle raging behind her eyes. Her ego demanded she dismiss this insubordinate nurse. Her professional integrity, however, whispered a different truth. Aisha's description, however outlandish, matched the lingering mystery of Javi's symptoms. With a frustrated sigh that was barely audible, Kovac exchanged her microforceps for a blunt nerve hook, the smallest and finest instrument for microdissection. Under the powerful magnification of the microscope, Kovac delicately probed the area Aisha had indicated. Her movements were precise, cautious. She gently attempted to tease apart the epineurium, the outermost fibrous layer of the nerve, from the underlying fascicular bundle. At first, there was only the expected resistance of scar tissue. But as she moved the tiny hook exactly where Aisha's finger had pointed on the monitor, Kovac felt it. A distinct, unyielding resistance. Not the diffuse stickiness of fibrosis, but a sharp, localized tethering. Kovac leaned closer, her breath held. She maneuvered the blunt dissector, trying to slide it beneath what she now saw, a gossamer-thin, almost crystalline fibrous strand, barely a millimeter wide, stretched taut like a violin string between the epineurium and the nerve fascicle itself. It was almost perfectly transparent, reflecting light in a way that made it blend seamlessly with the surrounding tissue. It was not a bulk compression. It was an internal strangulation. The tension in the oar was now a palpable force. Kovac straightened up slightly, pulling back from the microscope. Her eyes, wide above her mask, met Aisha's. There was no longer skepticism there, only a dawning, incredulous shock. "My God," Kovac whispered, the word barely audible, stripped of all her usual arrogance. "You were right. It's practically invisible." She looked back at the monitor, then again at Aisha, a new, unsettling respect dawning in her gaze. "How did you possibly?" Aisha simply met her gaze, a quiet confidence replacing her initial trepidation. "The nerve glide, doctor. And the patient's symptoms. They don't lie." The first, critical hurdle had been cleared. The unseen enemy had been found. Now, it was time for the release. The air in the operating theater, thick with anticipation and the sterile scent of antiseptics, crackled with a new, potent energy. Dr. Kovac, usually the picture of composed authority, was visibly shaken. The impossible had just become terrifyingly real. She took a deep breath, her eyes still wide, but a flicker of her renowned surgical focus began to return. She was a surgeon, and now, there was a job to be done. "All right," Kovac stated, her voice regaining some of its usual crispness, though tinged with an unfamiliar awe. She leaned back into the microscope, adjusting the focus. Aisha, describe exactly what you're seeing, the texture, the precise location relative to the nerve fascicles. Aisha, her voice steady despite the adrenaline coursing through her, leaned closer to the monitor. It appears to be a very fine, almost avascular fibrous band, doctor. It's originating from the epineurium, but it's tracking inwards, constricting multiple fascicles within the median nerve component. It's not a uniform sheath, it's a localized constriction, almost like a miniature tourniquet. She pointed to a specific point on the high-definition screen. Right there. The fascicles distal to that point show a subtle pallor, suggesting chronic compression and impaired microcirculation. Kovac nodded, her brow furrowed in concentration. She picked up a pair of micro-scissors, their tips finer than a human hair, and a pair of delicate jeweler's forceps. Her movements, usually swift and decisive, were now imbued with an even greater, almost reverent caution. This wasn't a standard dissection, it was an act of liberation. Under the powerful magnification, the scene was breathtaking in its microscopic precision. Kovac began the meticulous process, first using the micro-scissors to carefully incise the epineurium just proximal to the constricting band. She used the forceps to gently separate the healthy epineurial tissue, exposing the underlying nerve fascicles without disturbing their delicate structure. The fibrous band, indeed, was almost transparent, clinging to the nerve bundles like a spiderweb. We need to be absolutely certain we only release the fibrous tissue, Kovac murmured, talking to herself as much as to the team. Any damage to the perineurium or endoneurium could be catastrophic. Aisha kept her eyes glued to the screen, her medical knowledge from countless hours poring over anatomical texts and her practical experience in field nerve repair coming to the fore. The band is tightly adherent, doctor, she observed. It looks like it's fused with the perineurium of two specific fascicles. A very gentle blunt dissection, perhaps, before the final cut. Kovac paused, considering Aisha's input. It was unconventional advice to give during such a delicate procedure, especially from a nurse to a leading surgeon. But after witnessing Aisha's earlier accuracy, Kovac didn't dismiss it. She switched instruments, opting for an even finer, blunted microdissector. With painstaking care, she began to tease apart the fibrous tissue from the nerve fascicles, her hand movements precise, deliberate, and almost impossibly steady. Minutes stretched into an eternity. The operating room was silent save for the soft hum of the machines and Kovac's occasional whispered instruction. Then, with an almost imperceptible flick of her wrist, Kovac performed the final, critical release. The fibrous band, now free, drifted away from the nerve. As if a chokehold had been released, a subtle change occurred immediately. On the magnified view, the previously constricted fascicles seemed to visibly relax, their subtle pallor replaced by a healthier, slightly pinker hue as blood flow improved. Neurophysiology, report. Kovac demanded, not looking up from the microscope. Dr. Lena Hansen, the neurophysiologist, who had been meticulously monitoring Javi's nerve activity, spoke up, her voice suddenly imbued with excitement. Immediate improvement, Dr. Kovac. Somatosensory evoked potentials, SSEP, amplitude has increased by nearly 30% in the median nerve distribution. Motor evoked potentials, MEP, latency has decreased by 15% and amplitude is rising. We're seeing a significant, instantaneous restoration of signal conduction. A wave of palpable relief, quickly followed by quiet elation, swept through the OR. Anesthesiologist Dr. Chin gave a thumbs up from behind his monitors. Javi's vitals remained stable, but the internal measurements of his nervous system were screaming success. Kovac straightened up again, slowly pulling back from the microscope. Her face, usually stern, was now a mix of exhaustion, triumph, and profound humility. She looked at Aisha, her eyes gleaming. "My God, Aisha," she whispered again, the words echoing with raw emotion. You've done it. You found it. It's free." She looked back at the monitor, then at Aisha, a slow, appreciative smile spreading across her face. "The nerve is pulsing. The circulation is returning." Aisha felt a rush of adrenaline-fueled relief, but she maintained her quiet demeanor. He's going to be able to move his hand again, isn't he? Kovac nodded, her voice thick with emotion. Not just move it, Aisha. He's going to play again. That entrapment was directly impacting the motor fascicles for his grip and fine finger control. With this release, the prognosis is excellent for a full recovery. The rest of the procedure involved securing the nerve, ensuring there was no tension, and confirming complete hemostasis. Kovac meticulously closed the layers of tissue, her movements still precise, but now imbued with a renewed sense of purpose. As she placed the final sutures, she turned to Aisha. Aisha, Kovac said, her voice clear enough for the entire team to hear, what you did today was nothing short of miraculous. Your observation, your diagnostic acumen, your knowledge of this impossible pathology, it saved Javi Santana's career. And frankly, it's going to redefine how we approach these complex nerve injuries. The residents and nurses, who had witnessed the entire, improbable journey, exchanged glances, their respect for Aisha palpable. Dr. Kovac, the formidable head of orthopedics, was not only acknowledging a rookie nurse's expertise, but was openly praising her. The hierarchy of Apex Medical Center had just been fundamentally challenged. As Javi was prepared for transfer to recovery, a subtle change in his hand was already perceptible to Aisha. While still unconscious, the slight, almost imperceptible tremor that had been present in his fingers for weeks was gone. His hand, no longer locked in a subtle, rigid tension, lay relaxed on the surgical table, already showing the first silent signs of liberation. Aisha felt a profound sense of satisfaction, deeper than any she had experienced before. It wasn't about personal glory, it was about the vindication of a quiet truth, a hidden knowledge that had finally found its voice. Javi's career, once deemed over, now had a future. And in saving him, Aisha had inadvertently opened a new future for herself at Apex. The quiet nurse had, against all odds, become the hero. Javi Santana awoke slowly, the fog of anesthesia lifting to reveal the crisp, fluorescent light of the post-anesthesia care unit. His first conscious sensation was a faint, unfamiliar tingling in his right hand, a warmth that had been absent for months. He tried to clench his fist, a futile motion he'd performed countless times in frustration. This time, however, a subtle tremor, then a whisper of muscle contraction, responded to his will. It was weak, almost imperceptible, but it was there, a ghost of movement in a limb he'd believed was irrevocably lost. Aisha was the first face he truly focused on. She stood by his bedside, her expression a mix of professional assessment and quiet satisfaction. She gently took his hand, her touch feather-light. "Can you try to wiggle your fingers, Javi?" she murmured. He focused, pushing through the residual sluggishness. His index finger twitched, then his thumb. It wasn't the fluid, powerful motion of a star athlete, but it was voluntary. A wave of raw, emotional relief washed over him, tears stinging his eyes. I can feel it," he choked out, his voice hoarse. "I can move it." Over the next 48 hours, Javi's recovery astounded even the most seasoned medical staff. The rapid neurological return was nothing short of miraculous. Where before there had been only a disheartening lack of response during his neurological exams, now there was a clear, palpable improvement in both motor function and sensation. Nerve conduction studies, repeated less than 24 hours postoperatively, showed immediate, albeit still nascent, improvements in signal transmission velocity through the median and ulnar nerves, indicating the direct relief of the compression. Physical therapy began almost immediately, focusing on gentle range of motion exercises and neural gliding techniques to prevent adhesions. Javi, a man whose career was defined by relentless dedication, attacked his rehabilitation with a ferocious intensity. Each day brought visible progress, the return of a nascent grip strength, the ability to perform fine motor tasks like picking up a pen, the diminishing of the persistent neuropathic pain that had plagued him. The buzz in Apex Medical Center was electric, a wildfire of whispers and stunned exclamations that spread from the nurses' station to the resident lounge, into the hallowed halls where senior attendings held court. Dr. Kulkarni's definitive declaration of irreversible damage had been broadcast widely. Now, the impossible had happened. A rookie nurse had seen what the specialist had missed, guided the head of orthopedics to a precise, life-altering intervention. "Did you hear? Javi Santana, he's moving his hand." It was that Rahman nurse. She called it. Kulkarni said it was over. How did she know? Dr. Eliza Kovac, ever pragmatic and strategic, quickly understood the magnitude of the situation. Her reputation was riding high on this success, but more importantly, the hospital's reputation had been salvaged, even enhanced. During the weekly M&M, Morbidity and Mortality, conference, typically a forum for dissecting failures, Kovac stood before a packed amphitheater of physicians and residents, her voice clear and authoritative. "Today, we discuss a case that will, I believe, redefine our approach to complex peripheral nerve pathology," she began, projecting slides detailing Javi's pre-op scans and the intraoperative findings. The initial diagnosis, based on standard imaging and electrodiagnostic studies, indicated diffuse, irreversible brachial plexus injury. However, through the keen observation and unconventional diagnostic acumen of nurse Aisha Rahman, a critical overlooked factor was identified: a secondary, purely fascicular entrapment of the median and ulnar nerve components, undetectable by conventional MRI. She paused, allowing her words to sink in, then continued. Nurse Rahman's guidance in the operating room was instrumental in precisely localizing this subtle fibrous band. Her insight allowed for a targeted microfascicular release, resulting in immediate neurological improvement. Kovac's gaze swept across the room, meeting the eyes of her peers. This case serves as a profound reminder that expertise can emerge from unexpected places, and that open-mindedness, even in the face of established authority, is paramount for optimal patient care. A ripple of murmurs went through the room. Kovac, the formidable head of orthopedics, was not only acknowledging a rookie nurse's expertise, but was openly praising her. It was an unprecedented moment, a public dismantling of Apex's rigid hierarchy. Aisha, who had been requested to attend, sat quietly in the back, her face betraying little emotion beyond a slight blush. She appreciated the recognition, not for her ego, but for the validation of the truth she had seen. Days later, Dr. Vikram Kulkarni appeared at Apex. He looked tired, his usual arrogance replaced by a visible weariness. He sought out Aisha in the quiet of the nurse's station, the buzz around her having somewhat subsided into respectful whispers. "Nurse Rahman," he said, his voice surprisingly subdued. He stood a little straighter than usual, a subconscious effort to maintain a semblance of his former authority, but his eyes held a humility Aisha hadn't thought him capable of. I needed to see Javi. And to speak with you." Aisha nodded, leading him to Javi's room, where the footballer was already performing complex grip exercises with his physical therapist. The sight of Javi's hand, now moving with increasing fluidity, seemed to deflate Kulkarni further. He watched in silence for a long moment, the vivid evidence of his misdiagnosis playing out before him. Later, in a small consultation room, Kulkarni turned to Aisha. "I was wrong," he stated, the words clearly difficult for him to utter. "Completely, unequivocally wrong. I reviewed the intraoperative photos, the post-op NCS. The relief was palpable. The recovery is, frankly, astonishing." He paused, raking a hand through his hair. "I've spent my career specializing in peripheral nerve repair. How could I have missed it? How did you see it, Nurse Rahman? What is your background that grants you such an unorthodox insight?" Aisha met his gaze, her humility unwavering, yet a quiet strength resonated in her response. "My background isn't conventional, Dr. Kulkarni," she began, her voice soft but steady. "Before Apex, I worked with Médecins Sans Frontières. In places where imaging was a luxury, and surgical facilities were often improvised tents. I specialized in trauma, particularly complex blast injuries involving peripheral nerves, where the damage was rarely straightforward. We learned to rely heavily on nuanced clinical observation, on identifying the most minute, often overlooked signs of entrapment or secondary injury." Kulkarni listened intently, his expression shifting from curiosity to dawning comprehension. "Blast injuries, improvised surgery," he murmured, a new respect etching itself onto his features. Exactly. When a patient comes in with multiple layers of trauma, or a nerve has been subjected to extreme forces, the primary injury often masks secondary, more subtle issues. I learned to look beyond the obvious, to feel for fibrous scarring, to watch for the unique twitch of a fascicle under strain, to understand how nerves behave under extreme duress and how microentrapments can develop in the most unusual ways, mimicking complete transection. Javi's injury, while not a blast, had elements of that extreme, complex presentation. The irreversible damage was, in my experience, a symptom of that hidden secondary compression. Kulkarni leaned back, a genuine admiration replacing his former arrogance. Warzone field medicine, he mused. That explains it. A different kind of expertise entirely. One we, in our sterile, high-tech environments, often lose touch with. He finally looked at her directly, a profound respect in his eyes. Thank you, Nurse Rahman. You saved Javi's career. And perhaps, you've reminded me of something fundamental about medicine. Aisha simply nodded, a faint, contented smile gracing her lips. For her, the validation wasn't in Kulkarni's admission, or Kovac's public praise, but in Javi's moving hand, and the quiet triumph of seeing a hidden truth finally brought to light. The hospital buzzed with her name, her story now legendary, but Aisha remained grounded, her focus already quietly shifting to the next patient, the next challenge. Javi Santana's recovery was nothing short of miraculous, a testament to the precision of Aisha's diagnosis and Kovac's skilled hands. Within weeks, the paresis that had gripped his dominant arm began to recede. Physical therapy, initially focused on basic range of motion and nerve gliding exercises, quickly progressed. Javi, a natural athlete, attacked his rehabilitation with a fierce determination. He regained full active flexion and extension of his wrist and fingers, the ulnar nerve distribution in his hand showing complete sensory return, the former tingling and numbness a distant memory. The crucial fine motor control, once deemed irreparable, returned with astonishing rapidity. He could dribble a soccer ball again, the intricate footwork now matched by his arm's ability to fend off imaginary defenders, his fingers expertly controlling the ball and drills. Months later, to the shock and delight of the sporting world, Javi Santana was back on the pitch, his first goal a thunderous header followed by a joyous, uninhibited fist pump, a simple action that, just months prior, had been an impossibility. His career, far from being over, entered a new, triumphant chapter, his story a living legend of second chances. The ripple effects within Apex Medical Center were profound and far-reaching. Dr. Eliza Kovac, pragmatic and astute, wasted no time in capitalizing on the triumph. Publicly, she continued to laud Aisha's contribution, framing it as a testament to Apex's collaborative spirit and cutting-edge approach. Internally, however, the shift was more complex. Kovac, ever the strategist, recognized that dismissing unconventional talent was a luxury Apex could no longer afford. She initiated a new protocol for intractable nerve injury cases, mandating a multidisciplinary review that explicitly included input from all levels of staff, particularly nurses with specialized experience. It was a grudging, yet effective, reevaluation of departmental hierarchy, one that slowly began to dismantle the rigid silos that had long stifled innovation. Her reputation, initially bruised by the oversight, was now cleverly reframed. She was the leader who fostered a culture of inclusive excellence. For Aisha, the consequences were transformative, yet deeply authentic to her nature. Dr. Chen, the chief nursing officer, personally offered her a newly created position, specialist clinical nurse for peripheral nerve pathology. It wasn't just a title, it was a mandate. Her responsibilities would now include acting as a primary consultant on complex nerve cases, contributing to diagnostic protocols, and even assisting in the OR when her unique observational skills were deemed crucial. The offer came with a significant increase in autonomy and, crucially, the budget for further specialized training, an opportunity Aisha eagerly embraced, particularly in advanced ultrasonography for dynamic nerve entrapment. She accepted, not for the prestige or the elevated status, but for the inherent potential to help more patients, to bring light to hidden pathologies. Her workstation, once a nondescript cubicle, was now a small, dedicated office, though she spent most of her time where she always felt most effective, at the bedside, observing, listening, connecting. Aisha remained the quiet, unassuming nurse she always was, her scrubs her preferred uniform, her focus unwavering from the patient. But her quiet confidence now resonated with an undeniable authority. Doctors, even seasoned consultants, would approach her with deferential questions, seeking her perspective on cases that defied conventional explanation. The hospital culture, once fiercely hierarchical, began to soften, a quiet acknowledgement that true expertise could emerge from unexpected quarters. The nurse title was no longer a barrier but a badge of a different kind of clinical prowess. Dr. Vikram Kulkarni, in the weeks following Javi's full return to play, made good on his unspoken promise of self-reflection. He did not quit medicine entirely, as some had speculated, but he underwent a significant personal and professional metamorphosis. He took a 3-month sabbatical, not to travel, but to immerse himself in neurological research, revisiting obscure journals and forgotten case studies. He sought out experts in overlooked conditions, attending symposiums not as a lauded speaker, but as a humble student. Upon his return to Apex, Kulkarni announced the establishment of a new diagnostic dilemma unit within neurosurgery, specifically aimed at reevaluating cases deemed irreversible or idiopathic. He personally requested Aisha's consultative input, acknowledging her as the catalyst for this profound shift in his perspective. It was a public and humbling admission that shattered his former arrogance, reshaping his legacy from a brilliant but fallible surgeon to a pioneering advocate for diagnostic humility and innovation. He became a proponent of interdisciplinary collaboration, actively mentoring junior residents to look beyond standard imaging and to trust their clinical observations, no matter how subtle. Aisha's life outside the hospital remained largely unchanged. She still sought solace in quiet evenings, reading medical texts, but now with a deeper sense of purpose. Her expertise wasn't just theoretical, it was proven, vital. She continued to volunteer at local clinics, her gentle demeanor a comfort to patients from all walks of life. The media attention eventually waned, replaced by the persistent, internal hum of a hospital perpetually in motion. Aisha didn't mind, she preferred the quiet dignity of her work. The final testament to her impact arrived in the form of a complex referral, placed on her new desk, a young concert pianist suffering from focal dystonia with atypical sensory symptoms, unresponsive to conventional treatments. The accompanying imaging was unremarkable. Aisha picked up the file, her gaze thoughtful. She saw not just a challenging diagnosis, but a life on the line, a passion threatened. A faint, knowing smile touched her lips. The initial consultation was scheduled for next week. She knew it would require meticulous observation, a deep dive into subtle presentations, and perhaps another unconventional diagnostic maneuver. But she was ready. She had found her purpose, not in climbing a ladder, but in illuminating the hidden paths of human physiology, a quiet hero in a world often too loud to hear the whispers of truth. Her story at Apex was a reminder that the most profound insights often come not from the most celebrated, but from those who truly see. This was not the end of Aisha's journey, but merely the beginning of a new chapter, where her quiet strength and unparalleled insight would continue to redefine the boundaries of medical possibility, one patient, one intricate nerve pathway, at a time. And so, Aisha, now a respected specialist nurse, her humble demeanor unchanged, sat reviewing the file for an even more intricate case. Her quiet confidence radiated, born not from ego, but from proven insight. The hospital had changed, subtly but profoundly, its hierarchy less rigid, more open to the truth found in unexpected places. Aisha's journey reminds us that true expertise often whispers, unseen, until a moment of crisis demands it be heard. What did you think of Aisha's ascent and the transformation at Apex Medical? Share your thoughts in the comments below. If you believe in the power of overlooked talent and challenging the status quo, subscribe for more stories of quiet heroes making monumental impacts. Let Aisha's story inspire us all to look deeper, listen closer, and trust the wisdom that lies beneath the surface.